This is your MDKB's weekly dose of vitamins, so be ready to acquire knowledge. Vitamin A, also known as retinoids, which include retinyl esters and particular carotenoids like beta and alpha carotene as inactive forms, and retinol, retinol, and retinoic acids as inactive forms. It can be a little bit confusing now. I will simplify it. Retinol and retinyl esters, commonly known as retinyl palmitate, from animal sources, carotenoids from the plant sources, enter our body through the intestinal villi. Because they are all fat-soluble vitamins, they travel through the lymph, to the blood, and to the liver, where the liver converts all of them into retinyl esters and store them as an esters form. But when needed, the liver converts them into retinol, and this active retinol is further converted into two active forms of vitamin A by the enzymes known as retinol and retinoic acid, and each of them now can perform their functions. So the benefits of vitamin A is a lot because it has three active forms, as retinol provides cell growth, healthy skin, and collagen synthesis, and retinol, which famously provides good vision by producing rhodopsin, an important protein for the eye to perceive light, and retinoic acid, which provide growth and fetal and organ development. Other than these, the vitamin A also provide good immunity, reproductive functions, and also act as an antioxidant. There's a lot of benefit in it. But what if you don't take vitamin A? Obviously, you will have deficiency symptoms, which include night blindness, childhood blindness, skin problems, impaired immunity, enamel hypoplasia, anemia, and growth problems. So it's better to prevent them by adding it in your diet. Let's see what the sources from which you can get the vitamin A. Vitamin A is present in both animals and plant products. Retinol, retinyl esters, and retinoic acid, also known as preformed vitamin A's, are present in animal products like oily fish, eggs, livers, and dairy products. On the other hand, the carotenoids or the provitamin A's are present mainly in carrots, sweet potato, spinach, papaya, mangoes, and many plant products like that. You just need to balance your meals to take the right amount. The recommended daily dosage of vitamin A is about 900 micrograms for men and 700 micrograms for women. For the women in pregnancy times, is about 770 micrograms daily and 1300 micrograms for the breastfeeding women. And this is the chart from the National Institute of Health for the daily dosage of vitamin A. Well, the units are in retinol activity equivalents or RAE, but you can convert it into any specific unit by these measurements. So be careful with your math. But don't take more than 10,000 units or 3,000 micrograms of vitamin A in a day. Then it would cause more harm than good. Also, be sure to check with your doctor before taking any vitamin A supplement because it can also interact with other medications that you take for other conditions. So, as we are finishing up with our vitamin A, let's move on to another vitamin. Vitamin E, also known as alpha-tocopherol, is very famous for its antioxidant properties among the other vitamins. So, let's see why. Vitamin E is present in the foods in 8 different forms, but alpha-tocopherol is the most active form among them. After we consume it, as it is a fat-soluble vitamin, it travels through the lymph to the blood to the liver, where it is metabolized and stored. That's it. It is not as complicated as vitamin A. So, I'm not going to say what antioxidants are and their functions because that video is coming soon. But we need to know what the benefits of antioxidants and vitamin E are. Being an antioxidant, the vitamin E prevents the effects of free radicals, which include tissue damage like cardiovascular and inflammatory disease, and even cancer. Not only that, it aids in immune functions, slows aging, and prevents many of chronic or long-term diseases. As I said earlier, vitamin E prevents cell damage by the free radicals, and the major cells in our body that are frequently affected by those are muscle and nerves. So vitamin E deficiency can cause nerve and muscle damage, anemia, retina damage, muscular disease, and peripheral neuropathy. So it is better to prevent them by having the food like sunflower oil and seeds, olive oil, avocados, popcorn, broccoli, peanut butter, wheat germ oil, hazelnuts, and many more. The recommended dosage of alpha-tocopherol is about 15 milligrams of daily intake. And this is a chart from the National Institute of Health. Deficiency of both vitamins, both vitamin E and vitamin A, can happen not only because of their low intake in your diet, but also because of your body's inability to absorb fat, as both of them are fat-soluble vitamins. That's all for this weekly dose, everyone. Share this to your friends so that you can be part of our healthy league. Subscribe to my channel and turn on the notification button because more health-related knowledgeable videos are coming up. And stay safe, stay healthy, and be ready to acquire knowledge.